Hospitals, just like schools, have always been a mainstay of our society, but the current political scene has made them a a site of politics and infighting, and definitely of corporate profits. So, what we are facing today is the need to really, really focus, put our heads down, and focus on what we can do for ourselves. We need to be taking the time to understand what our body needs as far as water, fresh fruit, fresh veggies, cooking at home. This is the time where we should be attempting to decrease our stress, figuring out a game plan if we need to homeschool. All of these things that we need to do to focus on ourselves, because you can see the way the politics is playing out, that they are running nurses out of the professions, they're running teachers out of the professions, and it's only going to create a populace that is sicker and sicker. And then when they do need to go to the hospital, since it is very profit driven, is going to impact our finances. So this is all connected. Your health overall consists of mental, physical, emotional, and financial health. So if you get sick physically, that is going to hit your bottom line, your pockets, your finances. So it would behoove you to really understand and know what is going on in in the medical field, in the political climate. They are sabotaging our health, and that is only going to create more and more people that just have to go to work simply to pay off medical bills. It is going to stress people's pockets and our minds. So this is something that you really got to get ahead of as far as your health. You have to know what is going on in your city, in your state. These politicians are creating a system, politicians and corporations are creating a system that is unsustainable. And if you're not paying attention, and you're not paying attention to your own health and well being, you may be caught unaware. So stay tuned and stay aware. I have a lot of women that jump into my inboxes and share things with me that aren't being touched on enough. And I believe that we all know that healthcare is in crisis, especially after the pandemic. The pandemic highlighted a lot of things that were under the surface and not being talked about. And I believe that for whatever reason, this country is attempting to run out nurses and run out teachers. Well, this woman sent me this inbox. She says, FYI, nursing is in crisis mode right now. Take care of your health and that of your loved ones. What corporate greed is doing to healthcare combined with political shenanigans, the last place you want to be right now is in the hospital. So, so sad. Just like teaching, we are in trouble. So I've seen what is going on because of the pandemic, but I still wanted her to expound. And I do agree that we should all be taking care of our health, because just getting any kind of medical complications could really impact your finances and your health, because, medical debt can be crippling. So let's see what else she has to say. Okay, so here we go. Basically, healthcare corporations have chosen to intentionally function understaffed, except for California. There is no mandatory safe patient ratios nationwide. So you have one nurse to take care of 6 to 7 patients, when it really should be no more than 4 or 5. They charge sometimes a 100% to 400% markup on the charges for medication and medical supplies used for your care, whilst benefiting from not for profit status and bankrupting people unable to pay these unreasonable costs, while the CEOs are paid millions with millions in bonuses and patients' care is sacrificed. And then she mentions a company called HCA. And then she goes on to show this video, which is where there was a whistleblower talking about these contracts, these predatory type of contracts that they were having these nurses sign in order to come on, where if they did quit within 2 years, they were obligated to pay back thousands of dollars in supposed training costs. Now, HCA has been in the news within the last year. If you do a quick Google search of HCA, Okay, so there was a whistleblower, and I believe that one was in Florida. There was another HCA issue in Nashville. There's another whistleblower in North Carolina. There was something about roaches in Florida in the HCA. There were other articles, but this is just a quick search. So this is just to remind us all that taking care of our health is important because you really don't want to go to the hospital right now under these conditions. Now check out this video that NBC News did regarding the HCA Corporation. It's very illuminating. So go ahead, check this one out.
These conditions, I don't think anybody was made to be a nurse.
The conditions she's talking about relate to understaffing, which NBC News has investigated at HCA hospitals in 5 states, where some nurses and doctors say HCA's focus on profits, $5.6 billion last year, can put patients at risk.
The quality of care that we give is not what we want to give.
She says the hospital refused to let her work fewer hours, so after 13 months, she quit. But she had a problem. She'd signed a contract saying if she didn't work 2 years full-time, she'd have to pay back some of the $4,000 they said it cost to train her. Rum believes it wasn't training, but an 11-week orientation, which included basic onboarding, technical instruction, and shadowing an experienced nurse.
We see these contracts as a form of indentured servitude.
Bryn O'Neill is a lawyer and policy specialist at the largest nurses union in the country, with over 220,000 members.
Indentured servitude. Does that go too far?
I don't think so, because it's requiring people to work out a term based on debt.
These contracts are sometimes used by hospitals to staff the worst shifts and the sickest patients with the least experienced nurses, according to some of the 1,700 nurses O'Neill's union surveyed. In the past decade, these contracts have been used by a wide range of hospitals, including HCA, which says its training programs are more comprehensive and substantive than any standard job orientation.
The other thing HCA and many other hospitals say is there just aren't enough nurses. We're in a nursing shortage.
There are plenty of licensed nurses, but there's a real lack of safe nursing jobs.
In Utah, Bree Fellows also signed an HCA contract. If she quit before 2 years, she'd have to pay back the $10,000 signing bonus they gave her, as well as up to $10,000 in training costs.
Where's the hedgehog?
Fellows, who had 2 kids under 2 at the time, accepted a job on the overnight shift in labor and delivery. But 6 months later, she was pregnant, exhausted, and begging, she says, to work the day shift.
She said, "You're brand new. No, you can't."
Were there some moments while you were doing this job that you just thought, I'm not safe? I'm not safe for these patients. I'm not safe for myself.
Yes. Just like not catching things that I should have, like just staring at the screen at 3 a.m. It's just very scary.
After 11 and a half months, she quit. The hospital sent letters demanding she return her upfront bonus of $10,000 as well as $6,000 to repay her training.
It was very much a slap in the face, like this has to be wrong.
Frightened, she and her husband took out a new credit card and paid the $14,000 the hospital agreed to take.
These contracts are bad for nurses and they're bad for patients. With debt hanging over their head, a nurse has a much harder time speaking out.
HCA now tells us that since we started reporting on these contracts 2 months ago, they've decided not to use them anymore, though they declined to say whether they will enforce the contracts nurses have already signed or reimburse nurses like Bree Fellows. Meanwhile, the federal government is getting involved. The Federal Trade Commission proposed a rule banning contracts like these, which are being used in an increasing number of industries.